The following program contains graphic images that may be disturbing. Parents are advised that these images may not be suitable for young children.
That's rough in there. The second I walked out of that tent, it's just nuts down here.
This is General Hospital, and we arrived today. People were trapped, fractures, amputations, burns.
Wrist fracture, spine fracture.
It is like a mass shooting and heartbreaking. Absolutely heartbreaking.
Probably about 18 months. The wound is so extensive that she's going to need an amputation, which is very difficult, but it will be life-saving.
He's got deep second degree, third degree burns. This is a team effort here.
This baby's non-responding. She needs a stretcher and some morphine.
What I'm seeing here, it's overwhelming.
The Haitian government estimates some 200,000 people are dead.
Seeing the images on TV of what we're going to see down there has me pretty nervous.
They are waiting and waiting. Some trying to get into hospitals can't. Others pray it's not too late.
In a crisis like this, you can never have enough physicians, and I think this is going to be an emotional trip for all of us.
A steady stream of sicker and sicker patients continues to arrive. It's the facilities and the equipment that are right now non-existent on this island.
We have the ability to ask people to donate medical supplies to go with us, and the response, it's been great.
We packed 16 boxes, 4 doctor kits, 18 backpacks, over 7,000 pounds of medical supplies.
I have no clue under what conditions I'm going to be working, if we're going to be in a sterile environment. I don't know if I'm going to have anesthesia.
This is what it's all about, being a doctor. And I've done this before in Africa and India. I will see something I've never seen before in Haiti as far as the natural disaster and the degree of despair and damage that's gone on there.
One thing I think that's most important is we're going as a team. We're doing this together, and that makes me feel a lot more secure in this trip.
This plane will go to Miami, then from Miami we'll go on a charter flight to Santo Domingo, and then a 10-hour bus ride into Port-au-Prince in Haiti. It's definitely a bit of an adventure just to get there.
All right, first up, Miami. The trip's going to progressively get a little tougher each leg.
All our supplies and cargo's loaded. We got 2 airplanes on the ramp out there, and we're getting ready to head that way. Here we go. All right, everyone, we know we're going into an area that's been devastated by an earthquake, so first things first, we have to protect ourselves. Make sure you're wearing sturdy hiking boots. Make sure you're wearing gloves. There is the risk of HIV over there. The last thing we want is for one of us to go and come back and get sick. So take care of yourself, take proper precaution. Everyone got that? We're all gonna see things we've never seen before. You're gonna see a lot of crush injuries, you're gonna see a lot of infected wounds. And I think we're all gonna be very moved by what we see. And there are gonna come moments where we're probably gonna come together like a team like we never have before. Just got here to the Dominican Republic. I know it's a little before midnight, and we're leaving at 2 a.m., hoping to arrive at around noon tomorrow in Haiti. It's about a 10-hour drive.
My name's Art Salisbury. I am a retired Army Special Forces medic for this convoy and your mission down in Haiti. The reason why we're here to support you is the threat condition down in Port-au-Prince is deteriorating to the point where it may be unsafe. It's not pretty, all right? It's ugly. That's the best way I can say it. It's ugly and it's sad. When we get into the Port-au-Prince area, keep all the food and water out of sight. Get it underneath the seats. Don't be eating while we're driving into Port-au-Prince. Don't eat. It's going to draw attention. If something hits the vehicle, a rock, a bottle, or anything, get your head down, protect your head, stay focused on looking ahead and protecting yourself. And one thing, if any of us get out of the vehicles during this convoy at all, just let us do our thing. We'll have a safe trip, do what you came down here to do, and move on.
We just had our security briefing, and it's a little scary, having these guys talk about what's going on there and what we might expect and what to do if the convoy gets gets attacked.
It finally feels like our medical mission is going to become a reality. We just left Santo Domingo. We have 5 hours to the border and then another 5 hours going into Haiti. We've been traveling for 24 hours now.
We're all chomping at the bit. We're all very impatient because we want to be there and we want to be on the ground. And I have no illusions that this is going to be easy. I have no illusions that this is anything I'm ever going to have seen before. The reality is, as an ER doctor in America, I have access to almost anything I need at any time. Here, those resources just aren't available.
Right, well, we had to make a stop. One of the cargo vans got a flat tire, and it's kind of a big bummer because we're only about an hour into this trip. We've got another 4 hours to go just to get to the border. But at least we get out of the van, stretch the legs a little bit.
So as you can see, it's daylight out. We just came down a big hill and we came around a turn. There was a big stoppage on the road and a bunch of flour had fallen off the back of a supply truck, which I imagine was taking aid to Haiti. So we just got through that, and we're about 10 miles from the Haitian border. We've had a blown tire as well as some mechanicals on one of the vehicles. So hopefully we won't have any problems going over the border.
You're gonna be overwhelmed by it when you get in there, and it's not your textbook stuff.
We just ran into some doctors who are leaving Haiti, and they actually recommended that we put our names and MD on our shirts, on our scrubs, so that people know that we're doctors, because it is chaos, so people can identify us as doctors if they need us.
I spoke with one doctor. He had been in there for a week now. He's actually taking a break, coming out to get more supplies, but he told me, hey Jim, just get in there and immerse yourself, and it's going to become second nature, because it's just the need is so great and there's nobody treating these people, so pretty much anything you do is better than what's happening right now.
So right now we are just crossing the border. As you can see, this is the gate actually entering into Haiti, and you can immediately see a change. The road just went from paved to gravel. It's literally a little bit more chaotic the minute we crossed the border. We went from buildings to little shanties, and a definite change in just the environment.
People here have a look on their face of urgency and need and concern, because you know that their loved ones are there and are in need of you guys.
It's definitely much more focused and much more determined. Definitely a change in feel, a change in emotion. It's quite striking.
We're getting ready to hop out of the bus and head into the first hospital. And I'm putting some of this vapor rub on the inside of my mask, because everybody tells us that the worst part of it here is the smell of dead bodies. We just got into town. We just made our first pass through Port-au-Prince, and it's truly like nothing you've ever seen. I mean, the entire town is been devastated by this earthquake. You think that there's going to be destruction and some buildings are going to be done. It's the entire town. It's like nothing I've ever seen. And now we're at the hospital and the doctors are getting their gear and we're going to head inside.
Coming up, more with the doctors in Haiti.
A miracle happens every hour, trust me. We're going to get them, but now you're my miracle.
This gentleman actually was involved in an explosion. He's got deep second degree, third degree burns.
I know that hurts, sorry. It's overwhelming. I know we came down here knowing we were going to see some kind of crazy stuff, but it's just nuts down here.
The doctors' crisis in Haiti continues.
We're on our way right now to help out with some of the hardest hit victims. We really don't know what we're walking into, but we're about to find out right now.
We're actually on the grounds of the airport. The runway's right over there. They've set up a hospital here. As you can see, they're taking patients out on stretchers and a truck to get care somewhere else because there's so many people waiting.
When the helicopters come in or the ambulances come in, they come in right here. This is our triage area here. What we'll do is introduce you to your brothers and sisters and your specialty, and then we'll start to work from there. Okay. You feel like you're a resident again, because everybody's doing everything, and there's no pride, there's no nothing.
That's great.
Behind me here, you'll see 3 tents. There's logistics over here. This is main surgery, and over here is the pediatrics tent, and then triage is right here between the two of them. So there's lots of patients. They're all looking for care.
This is the adult hospital. I'm going to take you in there now. I would love if one of you would volunteer to be involved in wound care. Two in wound care.
Drew, you want you and I to do that? Or do you want to?
What we do in wound care is you go out in teams and begin to change the dressings, look at the wounds, change them. 80% of our patients have wounds. And we're changing the dressings every 2 days, 3 days, but we're very concerned because our big team of wound care people have not really come in yet, and a miracle happens every hour, trust me. We're gonna get them, but now you're my miracle.
Is she able to walk?
This is main surgery. That's where Dr. Orden and Dr. Stork are.
So this is kind of a mini ER here. Actually, very much like a normal ER. People come here if they're very sick and they need an operation.
Oh, he's got both sides. Wow. And over here is the pediatrics tent. That's where Lisa and Jim are.
Watch out, guys. Watch out. Watch out.
These medications are coming from all over. A lot of them are even in foreign languages, so it's a little challenge to figure out exactly what is what.
I'm taking care of a really young girl. She looks like she's probably about 18 months. The building actually collapsed. It crushed her right lower extremity, which is her right leg. And she's basically lost all of her skin on that leg, completely broken underneath. But the problem is the wound is so extensive that she's going to need an amputation. The wound is well beyond the muscle. And with a wound like that, especially under these conditions, there's really no chance that that's going to recover on its own. So she's inevitably going to get an above-the-knee amputation, which obviously is very difficult, but it will be life-saving for her. Just like a parent in America or anywhere else, these parents here who have survived the quake with their kids are very nervous, and we're just doing the best we can with the resources that we have.
I'm working with them today on some wound care. This gentleman actually was involved in an explosion. This is what we're seeing the most of here in the wound care clinic, are all these older injuries that were not closed, making sure they're not infected. The bandages get attached to those raw areas where he's lost his skin, so we have to go slowly. We have medicated him. I think we're going to get him comfortable now, be able to get these off. What happened was he was involved in a propane explosion during the earthquake, lost his wife, who happened to be a nurse. Nice. Silvadine on that, I think that ear is going to be okay. Real nice. We literally gave him general anesthesia. Normally I would be doing this in major operating room, but we really cleaned him up. As you see, he's got deep second degree, third degree burns. In a perfect world, I'd like to excise the burns completely, overgraft them. We can't do that, but we cleaned him up pretty well. The key is getting that dead skin off of his hands, his shoulders, his ears, and we're going to now put on special dressings, Silvadine, make sure he doesn't get infected, and I think he's going to do well. I want to make sure that we put web roll between the fingers and put a put them in a position of flexion. With these burned hands, if you don't cock these up in the position of function, they're going to contract. The wrist, the fingers are all going to shrink down. I've got to cock them up, dress them like that. The dressing is important as anything else. All right, he's going to stay here. He basically is an inpatient at the hospital. He's getting IV fluids, changes dressings, apply antibiotics every day. Still has a good attitude in spite of his burns, and I'm optimistic that he's going to do well.
So this is our first stop. This is a huge hospital that was just set up by University of Miami. The moment we got here, I kind of sunk into the pediatric tent.
Is he having trouble breathing at all? That's what that hurts.
La forma con el moyen, tel pesi formal.
Is he able to walk?
His back hurt?
His back hurts more than his leg.
It does? Okay.
X-rays.
You formal? It hurts a little bit.
Where does it hurt? We should do some wound care and get him to walk.
Okay. The wound's cleaned out. Now we're just going to dry it off a little bit and apply a antibiotic cream to it. This is Alan, by the way. He's 14. The house fell on him. Most of the patient's reactions are, they know we're helping them, and they know they need this, even though what I'm doing, I know that hurts, sorry. Even though it may be hurting, but they know they need it. Just the amount of care people need and how it's been over a week now, and people are still needing sometimes to get seen for the first time. It's overwhelming. Just can't think. I'll think later. I'll think on a couple days from now. That's rough in there. I know we came down here knowing we were going to see some kind of crazy stuff, but in the thick of it, whether it's assisting Dr. Orton in debriding a wound or helping it hold down a child, getting an x-ray, knowing that limb's going to come off. I was numb. I felt numb, and it was almost the second I walked out of that tent, it kind of just comes over you, and it's just nuts down here.
Coming up, more with the doctors in Haiti.
We just got pulled here to this hospital out in the field that was put up just like 4 or 5 days ago.
Everyone scoot back real quick.
She's unresponsive.
It's incredible in there. All the doctors are working round the clock, their hardest. They are phenomenal. I need her to go to x-ray. I feel like I'm needed here, and lots more doctors are needed here.
It's must-see February on The Doctors with Dr. Ruth.
She's back!
Everyone's favorite sexpert returns with a can't-miss edition of Ask Our Doctors.
Start the motor.
Plus,
she lost almost 240 pounds. Now the biggest loser, biggest winner, reveals the #1 mistake people make that keep them from losing weight
and keeping it on. From how he quit his cravings to the big secret he's been hiding.
Everyone wants to know.
Can I take a look at you?
Okay, you want me to go for it here?
And now the big surprise we have for the Biggest Loser's big winner. Plus the most embarrassing questions ever.
From the bedroom to the bathroom to the private parts of your own body.
From why things hurt.
Your heartbeat goes up, you start sweating.
How to cure dry patches, ugly ears, spider veins, and funky-looking feet.
Just use these.
And if you think that's embarrassing,
I never thought I'd be answering this question. Gonna go ahead and do it.
Then natural disasters, home fires, emergencies. Are you prepared?
Go call 911.
Plus,
It is the #1 important class that any parent can take.
life-saving lessons for new parents.
Minutes count. Within 4 minutes, a baby's brain can start to have permanent damage.
And preparing for baby.
I hope my water doesn't break on stage.
The triplets have you covered from pregnancy to childbirth and beyond.
And do you do this how many times?
Up to 5 times.
It's must-see February. 1 month, countless cures on The Doctors. The following program contains graphic images that may be disturbing. Parents are advised that these images may not be suitable for young children. The Doctors, Crisis in Haiti, continues.
So we just got pulled here to this hospital out in the field that was put up just like 4 or 5 days ago.
Does that hurt there? How about right here? Is that okay?
They're just doing amazing things, but it is like a mass unit here.
Everyone scoot back real quick.
What's his name?
Everything you could think of, they are doing what they can with what they can.
Jim, I might need to get something sharper to break
All
in
right,
here.
I got a pen. Would a pen, ballpoint pen work?
There are like 5 rows of beds in there. There are teams of doctors here, you know, and nurses who are trying to triage patients, get patients to the OR, get patients medication.
Do you speak English? No.
It's incredible in there. All the doctors are working round the clock, their hardest. They are phenomenal, and I'm pitching in to do, you know, what I can.
The 17-year-old, a brick fell on her head.
A brick fell on her head.
But she's unresponsive.
Yeah, I need her to go to x-ray. If you can lift her up and take her to x-ray for me. And I feel like I'm needed here, and lots more doctors are needed here.
Bonjour. Quel est le problème? Il s'est tombé. Oh, elle est tombée. So she fell. She looks like she has a hematoma or something like that. She needs to go over to pediatrics.
I'm trying to use my very old French, which is even a little difficult because they speak Creole, which is a different version of French, so it's a little, the communication barriers are difficult.
Quand est la naissance?
I need the neurologist. I'm so glad I saw you. This baby's like non-responding. The baby fell. It's just born like 4 days ago. Fell. It's not responding at all. It hasn't been eating. Hasn't been waking up well. She has an obvious hematoma. Yeah.
Is Sharon in here? Can she just take a look? Because OR
I think
is
she was
swamped.
just Dr. Green, so.
Can you take that to her?
Yeah.
Everything was happening really fast. As you can see, the organization is a little chaotic around here, but things get done. You just have to get up with meet the right people and get people in the right direction.
We came by to our supply area to pick up what we need. Travis is going to go out in the street, help some people. He's taking what he needs. I'm going to the hospital. They have patients that are waiting. I'm trying to pull the stuff that I need for that. Staple guns, sheets, suture, syringes.
I'm just actually right now pilfering for extra supplies, to be honest with you. We've already used a fair amount of the supplies. I'm just trying to get my hands on whatever I can. I'm actually going to the street now to go help out in a small impromptu clinic that someone we know has put together, and I'm literally just trying to get whatever I can get my hands on at this point. So it's a bit like a treasure hunt.
All right, Travis, 5cc syringes. We didn't find these, so this is better. I think we're ready to go.
Coming up, more with the doctors in Haiti.
I'm actually at a street clinic, and this was started by James, who is a former Army medic. He literally bought his own ticket here to Haiti. He set up this clinic on his own. I'm not gonna hurt you, okay?
And later.
We gotta go, guys. We gotta get her to the hospital. We don't know what hospital to take her to. Usually ambulances go to the closest hospital. They have to take the patient. That's not the case here.